years, the West Baltimore community residing in zip code 21223 has struggled with extreme conditions of poverty, including the lack of jobs, the lack of food, especially fresh, nutritious produce, poor health, high crime, mental health issues, including substance abuse, illiteracy, and substandard housing. Now, a coalition of partners, including Kaiser Permanente and Bon Secours Community Works, are joining community organizers to turn this blighted West Side into a community that thrives. Joining me to talk about future Baltimore is Destiny-Simone Ramjohn, Kaiser Permanente's Director of Community Health for Baltimore, and Talib, Horne, the Executive Director of Bon Secours Community Works. Welcome.
Welcome.
Thanks for having us, Tracey. Thank you. So how did your two organizations join together?
Yeah. So public health sociologists like me have an old adage that says that your zip code is a better predictor of your health than your genetic code. And as you said at the outset, West Baltimore zip code 21223 has some of the poorest health and social indicators in the state of Maryland. For example, 1 in 2 children in 21223 live below the federal poverty level. But there's another old adage that says, if you want to go fast, go alone. If you want to go far, go together. And so Kaiser Permanente has positioned ourselves in strong partnership with Bon Secours based on data and evidence that says we are here to transform the economic realities and lived experiences of individuals in 21223. Our shared community health needs assessment findings reveal that there are 4 critical health needs to improving health: educational attainment, economic opportunity, mental health, and community safety and security. And all those 4 needs are designed to be addressed by 9 programs and 1 community resource center that Talib will talk about in a moment.
Okay, and Talib, do you want to jump in?
Yeah, so Bon Secours has been in the West Baltimore community for over 100 years. Around 30 years ago, we created a community center on 26 North Fulton. In that building, which we believe is a beacon of hope, are signature programs in which the Kaiser investment will take to scale. There are 3 particular programs that I really want to focus on. One is our reentry, our returning citizens program. Close to 70% of those who get released from prison come back to our zip codes that surround the hospital, the 21223. We have a program that with the Kaiser generous investment will seek to employ and provide training for close to 50 or 60 returning citizens. We also have a grant from the Department of Labor, which will focus on 173. So over the next 2 years, we will focus on providing employment, housing, and all wraparound services for 173 returning citizens. The other key issue that really plagues West Baltimore is jobs. And so with this grant and this partnership, we will be able to train 100 West Baltimore residents in certified nursing assistants and geriatric nursing assistant training program. We have a 86% placement rate that once residents enter our doors, we do place them in employment. The multiplier effect, and the reason why I'm excited and Destiny's excited, is this resource center that we're looking to renovate. It's an abandoned library that's been abandoned for 20 years, and Destiny will talk about that particular project.
Yeah.
Okay. Explain this project. This is very exciting. What's going on?
So I think 4 health needs, 9 programs, 1 community resource center. We believe that the multiplier effect of having each of those 9 programs will be transformed by having them all under 1 roof. And the community resource center wasn't just our big and bold, bright idea, although we'd like to take credit for it. In fact, it was the neighborhood associations, including Fayette Street Outreach, Franklin Square, and Boyd Booth, as well as 2 faith communities that said, this is a location of symbolic importance to us. And we've sort of begun as a team saying that there is a mantra, nothing about me without me. So as we think about the advancement of both the resource center and how we shape those programs, community is driving and at the center of every decision that we make.
Wow. What is the overall goal of Future Baltimore?
I think the overall goal of Future Baltimore is break the cycle of poverty. I think West Baltimore for too long has lacked opportunity, and so I believe that Future Baltimore is a vehicle so that people can really reach their potential. In jobs and education, one of our signature projects is we're partnering with one of the lowest performing schools in the state of Maryland, Frederick Elementary School, where we have a staff there every day linking their parents and students to services. And so we really believe that this is not a transactional moment, it's really a transformational moment, that with this project we can really create long-lasting change for West Baltimore.
What is the first change that the community, the residents will see?
I think that will be the implementation of the 9 programs that we talked about. So as we think about what it means to begin to have incremental change, you're going to see many more individuals screened for mental health issues and referred to much needed services. You're going to see individuals who are returning home from prison and or jail receiving comprehensive case management services. And then at the close of 2 years, you're going to see the beacon of hope at 31 South Payson Street, which is that old library that will become a visible sign of hope in this community, and what we hope will drive additional economic development and revitalization to the zip code. So one key piece of that, of this partnership, is our economic revitalization. So over the next 2 years, we'll also incubate up to 10 businesses that will be located right in 21223, literally moving the needle on economic outcomes.
Okay, and how will this also help with the community and police relationship?
Absolutely.
One of our signature programs also is our first responder training. And so our commitment is that every police officer in the zip code 21223 will go through a training with our behavioral health staff, so they will be able to identify issues as they come in front of residents in West Baltimore, and also know where the referral sources will be. So the first responder training is very key. The other piece is advocacy. And so once a month on Saturdays, we provide advocacy and training to all the presidents of the community associations. And so we believe the future Baltimore will not only impact the police department, but also will help in terms of advocacy, so residents really believe that they can change and have the power to change their communities.
And I would add to that, when we think about the historical approaches that that have been taken here, we've seen some flash in the pan interventions where things start and things end. We are really committed as partners who share values around health equity and around true economic transformation to be here for the long haul. And we're committed to that, and our community members, I think, would agree.
And that's an investment that does need a long haul if we want to see changes.
Absolutely.
And finally, the nutrition. That's a big issue that needs to be addressed. I know that's a very important part of your program as well.
Absolutely. So healthy eating and active living, or HEAL for short, is a true component of what we know takes a commitment to investing and to ensure that we have health. As part of our partnership, we have our Hoop Gardens, which will provide food for up to 75 families per week. Kaiser Permanente donated 2 trucks that have been retrofitted that will mobily deliver those items. We also have established a program at Frederick Elementary School which will train young people in agriculture as well as food economics to hopefully break that cycle of poverty, like Talib said.
And so far, with that Hoop House, over 500 pounds of produce has been given away for West Baltimore residents based on that Hoop House.
Very impressive. Talib, Destiny, thank you so much. A lot of great things that you're bringing to the city, and a lot of great changes that we have for the future. So thank you.
Thank you. And our love language is gifts. So I just wanted to present you with a Future Baltimore notebook. We're so happy to have you having us here. Thank you.
Thank you. Thank you so much. And if you would like more information on the program, you can contact Bon Secours Community Works at 410-362-3629, or you can go to their website, bonsecoursbaltimore.com/communityworks.